Right. Good evening. Thank you all for being here. Oh, I gotta pop up about the recording. That doesn't want to go away. Great. All right. So thank you for being here. My name is Colleen Sabul. I am the statewide director of social work for the New York State Office of Mental Health. And I'm joined today with my colleagues, Gina Corona, who's a social worker at one of our state-operated psychiatric centers, Samantha Fletcher, who is the unit director for community workforce development at OMH's central office, and Heather Martin, who is the Assistant Director of Human Resources at OMH's central office. And we're joining you this evening to talk about the social work role in the treatment of marginalized populations in the public mental health sector. So as the Office of Mental Health, we are a public mental health provider. So we'll talk a little bit about what we do. All right.
Well, it looks like I just need to move the slide forward. If you want to continue, Colleen, I'll work on getting
No
the slide moving
problem.
forward.
Not a problem. So the first thing I wanted to talk about, which you probably don't need the slide for, is just the Office of Mental Health's mission. And, I think it's important for us to talk about the mission just to get some context. And it's also in line, I think, with the NASW Code of Ethics. So you can see how those two things pair up nicely. And since it's not on the screen, I'll read it to you. The OMH mission is the mission of the New York State Office of Mental Health is to promote the mental health of all New Yorkers with a focus on providing hope and supporting recovery for adults with serious mental health conditions and children with serious emotional disturbances. OMH is deeply committed to supporting underserved individuals, organizations, and communities. To this end, OMH is focused on implementing activities and initiatives to reduce disparities in access, quality, and treatment outcomes for underserved populations. So right there, you can see that our mission at the New York State Office of Mental Health clearly outlines that our role, and one of the things that we strive to do, is to treat marginalized populations through the work that we do in the public mental health sector. And again, I think it aligns nicely with the NASW Code of Ethics as well. So you can see where social workers fit into this mission for the Office of Mental Health really naturally. So who are we? The Office of Mental Health is the largest state-operated mental health system in the United States. I would venture to say probably worldwide, but that wouldn't be anything that I have verification of, but it is the largest state-operated mental health system in the United States. We are recognized as one of the best mental health systems in the country. And part of that is we do work with the Joint Commission to have all of our hospitals accredited. They are a national hospital accreditation board, and they come through and survey all of our state-operated hospitals, and specifically our state-operated hospitals, to make sure that we are meeting those standards, and those are national standards. So we can confidently say we are one of the best mental health systems in the country. We also, as the Office of Mental Health, even though tonight we are going to primarily discuss our state-operated systems, the things that the Office of Mental Health operates directly, I do want to make mention that we do license and regulate community and private sector programs. So many of the behavioral health programs that you see in your communities, at your local hospitals, PROS programs, community clinics, they may have an operating certificate or a license that's issued by the New York State Office of Mental Health to provide those services. And one of the things that we do is have some oversight, some regulatory oversight, to ensure that those programs, if they are operating under one of our licenses, are meeting the requirements that the Office of Mental Health has set for quality care for the treatment of individuals in the community. And we serve individuals in a variety of settings. So these are going to be, again, we're going to go back to state-operated settings, but we are inpatient, outpatient, and outpatient includes community clinics, residential services, and community programs like ACT teams, forensic services, and corrections-based operations. So we are located also in, and we'll get to this in a second, we are located in all of our prison systems, state prisons as well, which is one of the marginalized populations that I think folks don't often associate with the Office of Mental Health, but is really a key population to bring out. Okay. So where are we? We are all over the state of New York. And I'm sorry, my dog wants to join in. I hope he's not too disruptive. So we are all the way up to the Canadian border. We are all the way down to Long Island and all the way far west as Buffalo and the southern tier with Elmira and Binghamton, and then throughout the middle regions of the state. We cover multiple facilities here. You'll see that there are adult psychiatric center, children's, forensic, we have research facilities, and then our corrections-based operations as well are in each of the state prisons. The secure residential centers are specifically for individuals who have sexual offenses. And these are sexual offenses that are adjudicated in a very certain way under certain laws. So not every sexual offender goes to one of these treatment facilities. There's only certain criteria that meet the needs for those particular facilities, but we have 2 of those located, Oakview and Bridgeview. So I'm going to turn over a little bit of what we do to have Gina chime in here as a social worker in one of our facilities to really tell you a little bit about how, so when you have a sense of the scope of the system that we're operating within, she can give you some background though on what it's really like to provide this care to this large population. So Gina?
Thank you, Colleen. So my name is Gina Corona. I'm an LCSW or a social worker too with the Office of Mental Health. I work out of Hutchings Psychiatric Center in Syracuse, New York. If anybody's from Syracuse, hello. Right now, I work out of the outpatient, but I started as an inpatient social worker in 2006. What brought me over to OMH was I was performing as an intensive case manager, which is also a title shared by private sector as well as the state operated. And I was working in an office with both. In my work and working with kids and families, I was exposed to people who were working at the state. And what I loved about it was they had such an intensive interdisciplinary team that I pointed my finger and said, someday I'm going to be there. So years later, I decided I would take the test, which then back then you had to take a test. It was just really kind of a glorified resume. And right now it's a lot easier to come into this state, but then it was a lot harder. And I made it my mission. That was where I wanted to be. I wanted to work with kids and families in the inpatient setting. So I got to work with my favorite psychologist, my favorite doctor, and became part of an interdisciplinary team. And when you work as part of an interdisciplinary team, it really is so much more meaningful than when you're doing work on your own. Being able to have conversations about diagnosis, medication, family influence, really enhances the experience that the family and the child is getting in an inpatient setting. It is so much more intensive, and what you can do in a few weeks or a few months could take years for a kid to get from point A to point B. I also want to talk about the team also for the inpatient includes school services, and teacher services, for which a lot of our marginalized population are very unsuccessful. If you are a child, a lot of times your struggles are in school because either your interpersonal relationships or your academic skills are not where they should be. And our teachers were amazing. They do evaluations and assessments at the onset and schedule that child for school for 4 to 5 hours a day. And that child gets work that is meaningful because they actually get the materials from that child's school and they do not miss a day of school. Every bit of their education that they get at the hospital actually helps them in the long run. And you get to work with the teachers as a social worker to talk about how the diagnosis may influence their education. And they get to talk to you about how their educational stage right now is influencing them as well in their mental health. It's such a robust team that when your child, and I say your child loosely, but when your client leaves or your consumer leaves, they are usually in such a better place. You know, we do outreach to the schools, we do outreach with the family, but we can talk a little bit more about assessments and the other things that we're seeing on the screen. So with risk, we really look at where is this child or family or adult at, and what is their assessment. We do these at the onset. Some people come into us and have high suicidal ideation. Some of them come in and that is not what they're there for. They're there for other things. But we work together as a team to look at both inpatient and outpatient. What is the risk that person is experiencing, and then also identify what their resources are. For kids, it's their family, it's their parents. For an adult population, it might be their family as well, or it could potentially be that they're living in a residence, and that our ability to communicate with their permission, of course, but our ability to communicate with those resources to help keep them safe. Our team within also, because if somebody comes and maybe you're off or something, trying to make those connections and relationships are really important and powerful. Crisis intervention happens all the time. One of the nicest things, and probably the least known things, was, and even I didn't know this until years later, is our facilities are safety nets facilities. What does that mean? It means that anybody can walk into our open working hours any time of day and say, I need help. And one of us will engage them. We will do an immediate assessment as to whether their needs are imminent, that we need to get them to a hospital, or call somebody to help them work through that problem solving, or we can give them an appointment within the next few days and schedule them for an intake. But that is one of the lovely things of having one of these facilities, outpatient facilities in our community, is because these resources are there and they're viable and they are real. So when someone says, I can't find treatment, I just want to say, hey, have you gone over to Hutchings and just walked in during normal hours, or called up and asked for an appointment? Discharge planning, I'm sorry, I'm switching over, but I don't want to take too much time and I have the gift of gab. Discharge planning is a very important, part of our role as social workers, because we are the ones engaging with all of these resources in the community as we get to know our patients and we get to know, the things that they need in order to, be without services. We are looking at step down programs. We're looking at other programs in the community. And so they are a part of their plan, right? So we're having this conversation with them from day one. We're asking them, where do you see yourself? What do you want to do? Where do you want to be? Do you want to go to school? Do you want to finish and graduate? If that is so far out of reach, would you want something else? Do you want a GED? Do you want to do other things? And then what does it look like when you leave here? Do you want to continue treatment? Do you want to, find your own prescriber? For some kids and adults, they do very well after coming in, and they are just basically on a maintenance program and, are living their best lives is what we want them to do, right? We want to work ourselves out of a job is always how I was taught as a social worker, right? If you need me now, that's okay. But, my job is to work on having you not need me at all. In group therapy and individual therapy, we're either using the collective voices in the body of our patients as they are, and what that brings them in, and talking about skills that they can use every day to get through everyday stressors, right? Because most folks come to us when they're really not in the best place. And so if they're coming from for inpatient, usually it's imminent danger that brings them to us. And, what can we do to help them to identify resources and skills that they already have? They just may not identify them, and really support them around that. Understanding their medications, understanding their treatment. And then in the individual portion, we really delve into some of the more complex issues that may be, plaguing them at that time, and helping them through it, doing their treatment plans, and really helping them to see the progress that they're making on a daily basis, right? So, if I have a patient that comes to me and tells me, they're having crisis every single day, and yet, a month later, or 2 months later, or 3 months later, when I'm reviewing, when we talk about that, the number has gone down, and so has the intensity, that they've gone from, an hour of really feeling like things are very upsetting and dysregulated to, this last 15 minutes, they know what they need to do, and they're able to use those resources. That's an amazing place to be, right? So you get to, reflect on that with them and show them their progress. And lastly, their case management. I work with kids and families. You'll hear me talk about it a lot. I'm very passionate. It's been, almost 20, 30 years working with kids and families. So case management is just natural. I've had every resource probably under the sun in my office. Everything from, case managers and doing the case management, reaching out and coordinating with them, to referrals for home-based services. My favorite story is I had a young man who got himself in trouble. He was very young. He was about 12 years old. And he got himself involved with some gang related activities. And, you just don't want to mess with that. Mom would call me all the time, and she'd be like, I think he's doing this, or I think he's doing that. And, we'd ask him, and he'd be like, nope, 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 nope. So, mom came into my office one day. She was in crisis. She's in tears, and she's like, I need help. And, and I think this is going on. And, and I had a scary event. And she explained that to me, what happened. And I called our local gang task force, and they immediately knew who this mom was. And they said they'd be there in 5 minutes. And they were. They were at my office in 5 minutes, and we were able to collaborate about what next steps should be done to help this family be safe. So I can't tell you enough how much social workers play a role at OMH, in facilities, in outpatient, and how much you coordinate basically the treatment and the positive influences of people's lives at some of the worst times that they can possibly be coming to you. Did I cover everything, Colleen?
Yeah, I think that's great. Thank you, Gina. And I think the key, right, all of those things that you named are ways that we are well equipped, especially in the state system of the Office of Mental Health. We have so many resources, and we're richly connected to so many community resources, that we add all of those things to become protective factors. So when we're talking about marginalized populations, and, often when we think about the state psychiatric system, right, we take folks that other providers may not be as quick to serve, right? When we hear private providers say, I don't want to work with a gang affiliated kid, I'm not equipped to do that. Or our housing provider isn't equipped to serve this individual. We are. And we are often the place that has this wide variety and this wide safety net of resources that then become protective factors for those individuals, so that when they are back into the community in a different way, or don't need to see Gina anymore, we know that they have that new bank of protective factors, as they go back out to navigate whatever scenarios they were in before, hopefully better equipped to do so.
Absolutely. And I think as people make progress, a scary thing for them is stepping down and stepping away. In my practice, I always tell folks, you're not going to know if you're going to make it unless you try. And we're not going anywhere. So, we have the resources. All you got to do is call us. Some come back, some don't, and that's okay. But they know there's a level of comfort in coming to us because we are a resource that has and I brag about this, but we have very little turnover. A lot of folks that come to us have found their niche and they don't leave. They are folks that stay and really appreciate the work that we do. I can't talk enough about the team. I've been fortunate. I've had some really awesome, great clinical supervisors and have been able to have great conversations about resources and interventions and, really seeing movement in patients. We also talk about lack of movement in patients, right? Because sometimes we feel stagnant and we don't feel like we've moved things along. And what do we do? Sometimes they're not ready. Maybe it's not us, right? And sometimes it's just a matter of sitting the ride with them and keeping them safe. Sometimes it's making that more progress. It much varies with every patient. And I think the variety of patients that we see can be as easy as, someone who's stable with a condition that they manage every day to someone who is going to keep you hopping every time. And for that, we plan too, right? We always have a primary and a secondary. We have always keep our supervisors informed so that they're there as backup and can speak fluently to whatever the issues are going on with family or the kid or the adult. That's one thing I think we do really well is that that communication with the team.
So speaking of clinical supervision, that was one of the next things we wanted to talk about was how do our social workers get to be so good? But also, I think, what is it like to be a social worker in our system as a job, right? Because one of the things that comes up is, it's such a big system, right? So what does that mean for me if I were to go work at a prison or to go work, what does that look like for me? So we have I'm so sorry. We have a vast network of what it looks like to be a social worker at the Office of Mental Health. So clinical supervision is one of the big things that we offer. And I know Sam wanted to talk a little bit about this because it's one of the things that's particularly unique to working at New York State Office of Mental Health because it's built into our system. We have a robust clinical supervision system where every social worker is supervised by an LCSW, LCSWR, and it's part of the expectation of your job there is that you're going to that clinical supervision, you're getting provided that clinical supervision, and not just in a weekly or biweekly meeting. And it's not to talk about, did you do your clinical notes? It's to talk about real clinical supervision issues. We also offer a variety of things that are available as a social worker to you. So I don't know, Gina, if you want to talk about some of these. I know you've taken advantage of some of these programs that we have.
Sure, absolutely. So, I'm social worker for almost 30 years and I still receive clinical supervision. I like to think of it as consultation and continues to keep us growing, always thinking about things. And it's always good to make sure that you run things, off someone else, especially when you have a situation you're not quite sure. Consulting is amazing, right? Lets us sleep at night. And, one of the things on here is the free continuing education units. So we have access internally to OMH's CEUs, but we also have access because most of our social workers are under the bargaining unit of PEF, Public Employees Federation. We have an agreement with OER that we get reimbursement for CEUs. So if you are a PEF member and you are a state social worker, you automatically get these. You can sign up for them and then submit for reimbursement. If you are also a PEF member, you can get free CEUs through NASW and be reimbursed for your membership. So if you are a member, that's wonderful. And you are a PEF member, you should take advantage of the reimbursement as well. And if anybody has any questions, they can reach out to me directly as well. The public service workshops, we get those all the time. You can sign up for those. A lot of them come to us, with supervisor approval. You can even take them during the day. Some of them are short. They could be an hour, a couple of hours. You can do them right at your desk. Some of them are in person, and we sometimes have, every facility usually has some type of room where they use for trainings and stuff, and you can do that. Licensure reimbursement, we do reimburse. So the unions do reimburse, the union does, for the reimbursement for your license and your exam. You just have to take the test and pass. Our career mobility is an opportunity. It's almost like a grid, I think, where it says, okay, if your title is here and you want to be here, what titles can you transfer to? Where can you take a transfer, an upward title? You could also take a lateral title. There's also a lateral move. There's also, if you're an LCSW and you're in an LMSW 1 or 2 title, you can transfer to other facilities that have that title, right? We want you all to come here, but we also recognize that sometimes people's goals and ambitions are maybe something different, and you can transfer within the state system if you are interested. We have social workers at other agencies. You should tell them all to come to us. But there is a career mobility piece here where you can transfer upward and laterally as well.
Yeah, thank you. And I think, the other piece to this, and we're going to get into this in a little bit, but, it's just all of the different things that social workers do within our system. So we talked about, some of the direct care functions, right? Doing individual and family therapy or groups. We have all the different populations that we serve, from children to adults, but also different patient populations in terms of again, we're in the prison system. So if you're interested in criminal background, right? Some folks get the criminal justice, social work dual degree. And that's a great background for, working in one of our prisons. We have the sexual offenders programs, the STARK programs. They're called the Secure Treatment and Rehabilitation Centers, and they work with individuals who have committed sexual offenses. We've got kids in school clinics. We've got kids in our outpatient clinics. We've got kids inpatient. We've got, just so many populations and varieties of individuals to work with. But also, if you're not interested in working directly with those populations, we also have programs and opportunities to work, here it is, and to do all sorts of other ways to influence, right? So when we're talking about marginalized populations, and some of the ways that we help with that is policy and some of our administrative work. So at the Office of Mental Health, in central office, and in our field offices, we have 5 field offices across the state as well. And we're located in all of the different regions because we're looking at issues regionally. So if I work in, I'll use the Central New York field office, for example, it's right on the Hutchings campus in Syracuse. And they are uniquely positioned there to specifically address issues that are going on in those areas. So they're familiar with the community providers there. They're familiar with the counties. They get to know the county DCS. They get to know the local police departments. They get to know all of the people that they might be interacting with, the food bank, all of the resources that are there. And then we can start to craft our decisions and our guidance around the needs of the communities that we're working within and that we're serving. So if you're interested in more macro level social work, we also have all of those opportunities as well to really work within your communities at a different level, more systemically. really making sure that the community providers are meeting the needs of the communities they're in. We have a rural mental health project going on right now. We've got an Office of Prevention. We're really looking at community trauma and how to address issues of trauma in communities at large, not just individuals, but communities. We're looking at just a variety of systemic issues that are really impacting the mental health of New Yorkers. And so we do the clinical work, program management. When we think about within our facilities as well, there's also opportunities to be a social work supervisor, be a social work director, to oversee the social work programs, but also to look at ways that our hospitals operate. So do you want to be the chief of inpatient services and really look at what does it mean to run an inpatient service at a hospital? What should an inpatient service look like? What does a community service look like? What do our residential programs look like? Our director of residential and community services is a social worker. So what should our homes look like that people move into? And so there's a variety of ways to address that. And one of the things that they capture are those community populations. So if we find that there is not housing in a particular area to serve individuals who have comorbid medical needs, then we're going to pull in a social worker that works in our residential services program to really look at how do we bring resources like that to those areas, to those individuals, and make sure that we can get funding, make sure that we can get all of the access that people need. And then the quality management and licensing and certification, because we want to make sure that not only are the services available, but that they're good. So we look at the community providers and say, you know, do you meet our standards? Are you meeting the regulations? Are you providing people with timely appointments, services? Do you address risk needs, right? So if there is an adverse incident at your clinic or with an individual, are you addressing it? Are you putting in plans to protect people in the future so that these things don't happen again? So these are all ways that we as a system use social workers to influence change and to really make sure that people have the opportunities and the access for the services that they need at all levels, right down to I sit with a kid on the floor at school who's having a bad day, all the way up to I'm going to help design a residential program to make sure that it's accessible for someone, all the way to there's a prisoner in a special housing unit that's, you know, thinking about harming himself, and I'm going to go to that prison to sit with the prisoner. So there's the variety is huge, and but it's making a difference for New Yorkers at all levels, all over the state, every day. So, and I think Heather wants to talk a little bit about if any of this sounds like the kind of social work you want to do, how you could join us.
Sure. Thanks, Colleen. So I hope just from Gina and from Colleen, you've really been able to sort of get a sense that the Office of Mental Health, we serve the underserved, right? We serve those that don't have the access that everyone has. And so there are so many different ways as a social worker that you can have an impact. And like Colleen said, it could be at that clinical level. It could be at a program management level. There's lots of ways that you, in the discipline that you've chosen in social work, that you can truly, truly make a difference. And so if this sounds like something that you're interested in or learning more about, right now is a really, really exciting time to join the state of New York, specifically the Office of Mental Health. And Gina said this earlier, when she joined, she had to take an exam. And traditionally, when someone comes into state service, they have to take a civil service exam. Well, right now, those exams have been suspended, which means that if someone meets the minimum qualifications for a particular title, they could be considered for an opportunity to be hired at one of our facilities. And so again, it is as simple as expressing interest, seeing if you meet the minimum qualifications, and the minimum qualifications for our very first entry level, what we consider social work title, is license and registration to practice social work in New York. If someone has experience, that's different. They can also be considered for a different title, but that's the minimum qualification to be considered. The program that's suspending the exams is called New York Helps. It's on the screen. It is a program that's open to all state agencies right now, but it is a time-limited program, meaning that it is available from essentially May of this year till May of 2025. After May of 2025, examinations will come back in. That doesn't mean you can't get in that way, but right now, this is really such an opportune time for you to really consider and join, the state workforce, and it is a lot easier than taking an exam. So with that being said, I do have a link that's on this, which I will share in the chat, as well as after the presentation, we'll send a follow-up with some of this information where you can apply directly online. So again, if you're interested, you can apply directly online. Again, we'll share this link in the chat as well as in a follow-up after the presentation. But if you have any questions, again, we'll put this in the chat, whether it be questions about how am I considered for a position with the Office of Mental Health, or maybe it's a programmatic question, right? Maybe you have a question again about the services that we provide. Just send an email to omhrecruiter@omh.ny.gov. It is a mailbox that I monitor, and I will then make sure that that email gets forwarded to the appropriate person, or I'll respond to you directly. And if you just want to explore and learn more about who we are, our website's on the screen as well. It's omh.ny.gov, where again, you can see a lot of the programs and initiatives that Colleen and Gina spoke about. So, again, thank you. And I'll turn it back to Colleen, and if there's any last minute thoughts before we maybe take questions.
Yeah, no, I appreciate it. And Sam has been monitoring the questions. I think I'll have her chime in shortly with those. But I just want to say, this was such a quick overview. So I think the website is a great place to go. It will show you the variety of programs that we have, the ways that we are trying to impact communities at all different levels. I think we're really making a great effort to move away from the institutional model that we once were many years ago and really be a community recovery focused agency, really expanding our influence to the communities that people live in, and really recognizing that there are such a broad variety of needs for mental health of New Yorkers, and social work is the second largest discipline in the state Office of Mental Health. So we are a huge, huge workforce of people out there trying to make this difference, and we are at all levels of leadership. Our exec dep commissioner is a social worker. So we have social workers leading our agency at every level. So you will see the influence of that at every level throughout what we do. So I think it's just really important to note that as well. So I'll turn it over to Sam for questions from the chat, and hopefully I can answer them, or one of us can.
Okay, so I was going to start with, you had mentioned me when you're talking about the clinical supervision.
Oh, yes, please.
I just want to chime in on that a lot of our newer social workers or younger social workers may not know the laws and regulations around supervision for social workers in the field. A social worker cannot hire their own supervisor. It's illegal. The supervisor, your clinical supervisor, has to be hired by your agency. They can contract with them, but the agency has to pay for your supervisor. And you also have to be getting your clinical hours and an approved placement through New York State Education. So you want to make sure you're looking at all of those things when you're applying to jobs. We have a few questions in the chat. Okay, so Jessica had a couple of questions. She's from Buffalo State University. Her first question was, uh, can a bachelor, someone with a bachelor's degree, work at OMH? I know the answer is yes. And I see Gina and Colleen and Heather all unmuted, so you all could tell them tell Jessica that process.
Sure. So there's lots of opportunities for bachelor's level social workers at OMH in a variety of titles, but specifically in the social work title series, if you're looking just, to really work in the social work department, it's a social work assistant. And social work assistants are key. I am constantly advocating for more social work assistants, so we would love to have you. So we use social work assistants in a variety of roles. They are on our mobile integration teams, working with people in the community, actually going out to people's homes and meeting them where they are, really making sure that they have all of those case management type services in place. Many of them are what we call benefits counselors. So they're looking for benefits for people, making sure that people have their insurances in place, all of the documentation that they need to be successful in the community, linking them with services in the community. These are the people who are going to help. So if I show up and I'm here to have my therapy appointment with Gina, but I can't concentrate on that today because I'm really worried about food at home, or if my power is going to be turned off, Gina can send my information to the social work assistant so that I can actually focus on the therapy that I'm trying to get. And in the meantime, the social work assistant is in the background calling the power company, setting up a food delivery service or a food bank appointment, and making sure that all of those things are taken care of for you so that you can really focus on your behavioral health concerns. So yes, social work assistants are wonderful, and we love to have them in our division. But there's lots of other things that a bachelor's level social worker can do. I think the best thing to do, and Heather, correct me if I'm wrong, but it's just to go to the website and see what tests and, items you qualify for.
Yeah, and just to follow up on that, social work assistants are actually part of the HELPS program. So again, this is a perfect opportunity where you won't have to take an exam. So social work assistants are part of the HELPS program. So if you go to the website, omh.ny.gov, and you go right to our employment page, there is a section that specifically says social work assistant. There's a learn more button, and then there's an apply button. When you click the apply button, you'll fill out a basic form where we ask for your contact information, and we'll get that, and then we'll be able to reach back out to you depending on the location that you're interested in. So again, yes, ultimately great. If you're working toward licensure, that's certainly an opportunity, but if you're at the bachelor's level, you then may have some opportunities while you're continuing your education and training.
And I was just going to say, continuing education and training credits. We, as social workers, sometimes take on students. And when we take on students, we are earning credits for our facility. And that in turn can be utilized by our colleagues and peers who may be working on a degree, which gives back to our facility. And so you can be working on your master's degree while you are still working at the facility full time. We do have education release time at times. So it's an opportunity to continue your education and potentially get free credits.
Okay, thank you guys. And we have a few more questions. I want to make sure we get to them because I know we can answer them. So Jessica is also trying to get students into some of the OMH facilities in Erie. So I had suggested to her privately that she email that general email, and that Heather, you would be able to connect her to the right people. Is that the right advice?
Absolutely, yeah. And I think we can loop in some of our other contacts in state program ops too, where we can then sort of make some of those connections. So yeah, please email to that OMH recruiter mailbox, and we'll make sure that we get you connected with the right people.
Perfect. And then Joan asked, and I can actually answer this question. Joan asked, are there opportunities for doctoral level social workers at OMG? I am a doctoral level social worker, and I work at, she said OMG, but she meant OMH, and I work at OMH. So one thing to keep in mind for social workers who have a PhD or a DSW, that is not tied to Medicaid reimbursement rates. Your LCSW, that is the terminal degree for clinical social work, is that licensure. So if you're talking about doctoral level, like I have a PhD, there are a lot of PhDs who work at OMH, and we do a lot of different macro type jobs there. If you have an LCSW, you can do clinical, whether you have a PhD or not. And there's also the PhD psychologists who work, and now their PhD is tied to Medicaid reimbursement, so they can do clinical services with their PhD. So I answered that right, ladies?
Yes, and I just want to make mention, we do have doctoral level social workers. We have one that is an executive director of one of our hospitals. So they do a variety of things, as you said, Sam, but more, but the direct clinical work, we don't require the PhD or a DSW, but we love to have people with a variety of experiences and education levels, obviously, because you bring something to the table.
Exactly. And let me tell you, I learned so much from our clinicians there. I've grown so much in my understanding of what the clinicians do since I've worked at OMH for the last almost 8 months. I have a question that Vera direct messaged me, that she said, are there opportunities for contract or subcontract opportunities for agencies? The answer to that is yes. So Gina and Colleen and Heather are all representing what we call state ops. So everyone who works at state ops has an OMH email. You're an OMH employee. Now, OMH also license, funds, and designates over 4,000 agencies who provide mental health services. For those agencies, you can apply to our RFPs, and a busy year at OMH for RFPs are 8. Last year, we had 54. RFPs going out into the community to add ACT teams, pros teams, different children programs. And that's really where your agencies can apply for RFPs to run one of these OMH licensed, designated, or funded programs. So I will put the procurement page, or if one of you can pull it up quickly to put it in there, that would be great to get that information to Vera. There was another question that came a little earlier that I wanted to address, and I think she already left, but I want to go ahead and address this. Tony was asking, she wanted to know about community.
Thank you, Sam.
Oh, yes, thank you, Vera. She wanted to know about community mental health access barriers. She's in the Buffalo area and was talking about the immense grief with the 2nd year anniversary, of course, that horrific shooting that happened at the grocery store. So that's actually my area. I was brought in to create this workforce unit for the community providers, so those licensed facilities. One of the greatest barriers that all across the state they're having is the workforce crisis. So I just want to let you know that we are working on multiple initiatives to support not only our designated and funded and licensed facilities, but also I work very closely with Heather and Colleen on the state ops side. So we are looking to address that workforce crisis as quickly as possible. It's going to take a while. As you all know, it's complex, but that is something OMH is committed to doing. And then there was another question from Joan that I can't answer, but that you all can answer about, let me get to it. It was about
the first common profession. Yeah, it's nursing. Yes. So our nursing is our largest profession, our discipline at the Office of Mental Health. Nursing includes everything from nurse practitioners to LPNs, RNs, nurse managers, facility supervisors. We have a lot of nurses. It also includes our therapy aides, our mental health therapy aides, and secure care therapy aides are all part of our nursing department. and probably more that I'm not even thinking of, but they are our largest discipline, followed by social work.
I knew you'd know the answer to that. And then the last thing I saw, but I just saw something pop up, so I'll check that. Tama is graduating in August from Adelphi, so I just want to say you should apply, Tama. Like, you should look at OMH for your employment. I just want to throw that out there. And congratulations on your graduation. Oh,
Thank
and
you
you
very
just
much.
emailed a question. So you're going to take the exam soon after. Are there opportunities waiting to take the test? So they haven't, she's gonna graduate in August. She wants to take the test to get licensed as soon as possible, but what can she do in the meantime? So I'm gonna hand that over to you all to answer.
Yeah, I think social work assistant is probably the best option in the interim. Heather, I don't know if you have other thoughts.
Yeah, I mean, that's the first thing that would come to mind. But I think, again, going back to the OMH employment page and looking at the different opportunities, what do you have from an experience and education perspective that meets the minimum qualifications for a particular title to at least get you started with us, right? So Colleen mentioned earlier, we have direct care staff, right? So direct care staff work directly one-on-one with our patients every day. And so maybe that's something that you might be interested in as, again, waiting to get your license results and all of that. So there's lots of different ways that you can get started with the Office of Mental Health, which means that you don't have to wait until you have that license in hand. So I would just encourage you to go to our employment page and explore opportunities. And if you're not sure, then email us at OMH Recruiter, and we'll then, kind of have a conversation offline as to what works for you.
Thank you.
And I just want to tell you, Tama, if you want to be a clinician, I highly suggest looking at OMH to work, because the clinical training at OMH and the wraparound support you get in the clinical teams, the psychiatrists are amazing, the nurses on staff are amazing, the social workers are amazing. It is a very, very solid clinical training that, I mean, you'd be able to work with anyone being trained at OMH.
Excellent. Thank you so much.
I would even go further with, I'm very grateful that my training started as an inpatient social worker and then went to an outpatient, because when you're outpatient, you're doing a lot more independent work. When you're an inpatient social worker, and if you're very new, you get a lot of support. You're doing meetings every single morning on your patients. You're doing rounding with doctors. There's just no replacement for that type of consultation. It's like you and a doctor are deciding, how are we going to make this person better? And who do we need? I mean, that is just a very amazing and powerful position to be in. And I remember my favorite doctor, Dr. Gilbert. He was absolutely phenomenal. I mean, he would look at a patient, he would do the history, we would do the history together. And, he could look and formulate the direction he was going to go in. And then he would consult with us, he'd ask us our opinion, and we would make a decision. We talk about timelines for feedback. I mean, these are things that you just cannot pay for, right? The ability to look at a treatment plan unfold in front of you and then see the outcomes weeks later. One of the best things, I talk about the school, but school is such a amazing place, because it's a place where a lot of our kids either thrive or they don't, right? And to find the best case scenario for that and see them have these great outcomes and discharge back and be successful is one of the best things you can experience. So for me, inpatient was where it was at. I really loved my IP experience and really felt that gave me the best training I could ever ask for.
I think that's it, Katie. I think we got through all the questions with 2 minutes to spare.
Awesome.
Wow.
Well, I want to say thank you to all of you for coming this evening, and a huge thank you to Gina, Sam, Heather, and Colleen for your time and for answering all these questions. And if anything comes up after this, should folks just email that OMH recruiter address as well? Okay, awesome. I'll put that in the chat one more time too.
It was very nice
and then
meeting
Katie,
and
yeah,
Kate and
Katie,
Olivia.
we're gonna have some information that we'll forward to you, Katie, if you don't mind forwarding it to everyone that attended. Just some additional takeaway information. But again, the email address is the best way to reach us directly.
Absolutely, yeah. So I'll make sure that everybody gets that as well via email after the program. And this is also going to be available on our YouTube channel if you want to take a look at the recording again and refresh your memory on anything. But again, thank you all for coming this evening and for taking this time. I really appreciate it. And I hope everyone has a great rest of your night.
Thank you. Thanks for having us.
Thank
Thank
you.
you.
Thank you, everyone.
Thank you.
Thank you.